Hello and welcome to my channel. My name is Jeanette. And in today's episode, I wanted to talk about 5 ways in which a nurse can increase her income, make more money. So, one of the first things that I did was I became a preceptor. So, after working on the unit for a certain amount of time, I had increased my skills in learning to put in catheters, starting IVs, even learning my assessment skills, what's normal, what's abnormal. I turned into that go-to person that the manager will come and ask a question in terms of what can we do better. If something needed to be improved, they would ask my input. So then they now task me with now starting to teach new nurses. So I did take classes. So I did go to a preceptor class. And so I had that book that I can always refer to. Um, then they will send me to different forums where I would meet with other preceptors and sort of learn from them. And then when that new nurse will come, I would be assigned to that nurse and just help them to get through that initial starting on the unit, some of the things that can help them. Some new nurses, even seasoned nurses, when you move to a different area that may be you're not familiar with, you have a lot of questions in how to just do things right, and sometimes time management. You have only certain amount of hours to work and you want to get everything that needs to be done, so how to prioritize what you have to get done in that day. And as a preceptor, you want to teach them the correct way. And when you become a preceptor, you do get paid for becoming a preceptor. I should say, at my facility, you do get paid for preceptoring nurses. Another thing that I did is, after working a certain amount of hours at the same place, like I was working in PACU for about 11 years, and I was working in phase one PACU. I had done phase two and the pre-op section of it, and I had now learned the skills of the phase one PACU. And that's where you actually, some patients may still be intubated. They're just actually waking up from anesthesia. So after working in that setting for a while, I actually started studying the test, studying to do the CPAN test, where I'll be certified in that post anesthesia setting. After I passed that test, I did get an increase in my pay. Another thing that can help you with getting more money is actually that ladder system, that clinical ladder. And it may have different names for different organizations, but that's where, when you come in, you're probably a registered nurse one, you're just starting out. And then after you probably get your bachelor's, you may go to a registered nurse two after being there for maybe 3-4 years. And then you can take on projects. You can also join groups like Plant Tree, the UBC, and then you can go up to like a RN3, RN4 if you have your master's degree. And as you climb those ladders, you actually increase your pay. So that's 3 ways so far. Another way I tell my staff, my fellow nurses, is, according to your lifestyle, you may want to shift to an afternoon shift or a night shift. Like right now, I have a young nurse that she thinks a she wants to go into the anesthesia program. She's thinking a CRNA. And so I said to her, well, you must go into the ICU setting so that you get that sort of nursing. You need that skill, that critical nursing skill. So right now, when she's looking, she's just seen night shift. Now she has her husband, but no children. So I said to her, you need to look at your life and see if maybe if you change to a night shift or afternoon shift, you do get what you call a shift differential. Again, that's where I work. You do get a shift diff, and it may be added $4, $3 an hour to your pay. And that makes a big difference, because when you take $3-4 an hour and you multiply that by 72 hours or 80 hours, it does add up. So that's another way I tell people that you can actually make more money as a registered nurse, is you can change your shift. Normally day shift makes the least amount of money, then the evening shift picks up a little bit more, and the night shift does make a lot of much more money. But some people, as I said, are not able to work the night shift. Some people just need to sleep in order to keep a balance. So it's not just about the money, but as I said, today's video is just showing you ways, if it works for you, ways in which you can make more money as a nurse. Another way that I got a little bit more money was being charge nurse. So whenever I was in charge, I would get that extra charge nurse pay, because I would have to make the schedules. Like when I worked in the anesthesia setting, I would have to look at how many cases we're going to have the next day, making sure that I bring in those nurses to make sure that once the OR starts flowing out, that I have nurses to recover my patients. Again, if it's like pediatric, that's another story. I had to make sure that I have enough nurses to cover my pediatric population. Plus, I may have to throw some adults in there. And it's not easy. It's also not wise to have a nurse taking care of a pediatric patient along with an adult patient. And there are criteria that Aspen has in which, who are you supposed to be taking care of at that time. So I had to look at those um, at all those metrics and making sure that I have a good staffing arrangement for the next day. So being a charge nurse, that also helped me to make some money. I had to go to the different meetings to make sure I had beds, because if I have 60 cases, and out of the 60 cases, 30 is going to be needing a bed, but they might not need to stay on the same unit. So I had to make sure that I'm able to meet with the different unit leaders to make sure that they're able to guarantee me, hopefully, a room where I can put these patients, these post-op patients. So again, let me just recap. This is 5 ways in which a nurse can make some extra money and make more money as a nurse. You can, one, become a preceptor, and preceptor new nurses are nurses that are transferring from one unit to another. You can get certified in the area after you've been there and work a certain amount of hours. You can get certified in that area. Or you can climb the clinical ladder. You can go from a clinical nurse 2 to a clinical nurse 3. There are requirements, but there are things that you can do to get to a clinical nurse 3 or 2 or 4, and you can get more money. Fourth, as I said, if it does align with you, you can do a shift change where you can change to the afternoon shift, or you can change to a night shift. And normally those shifts will pay more money. The shift diff, we call it, they will pay more money. And lastly, as I said, you can be a charge nurse for the day. You do make a little extra money being in charge, since you have to get the unit, up and running for that day and possibly the next day. If you have any other ideas, you can just leave them in the comment box. If you take a minute to share my video, I will greatly appreciate it. Until I see you again, stay safe and stay wise.